Good morning, everyone. My name is Corsita Garraway, and I have the distinct pleasure of being the student rep today. I come to you from land that I would like to respectfully acknowledge that we sit and gather on is in traditional the Mi'kmaq territory. We are acknowledged with respect the diverse histories and cultures of all the Mi'kmaq, the Innu, and the Inuit peoples of this province. So Juneteenth is a word that was put together by two words, meaning the word June and the word 19th. January 1st, in 1863, President Abraham Lincoln issued the Emancipation Proclamation declaring that all enslaved persons in the Confederate States of America in rebellion and not in the Union's hands were freed. However, it was not until over 30 months, 2.5 years, in 1865 on June 19th, after the Northern States defeated the slave-owning South in the United States Civil War that enslaved African Americans in Galveston, Texas, were told that they were free. We come together today in celebration of the many lives that we have positively impacted and celebrate as one new, as I now introduce you to Dr. Danielle McCamey.
Greetings and welcome. Welcome to our Board of Directors, the Advisory Committee, honored guests, family, friends, and especially to our distinguished graduates of the class of 2022. It is my pleasure to welcome you to the DNPs of Color virtual commencement. My name is Dr. Danielle McCamey. I am the founder, CEO, and president of DNPs of Color. I extend my most heartfelt congratulations to all those that have received their degrees. I want to take time to acknowledge the support from those that have helped you along the way. To all the family and friends with us watching the ceremony or thinking of the graduates as they celebrate this moment, thank you. Before we begin the celebration, I'd like to start with a moment of silence and reflection for our friends, family members that could not make it to this day, and in honor of Juneteenth weekend. Let's connect through the energy for each other, the presence of our ancestors, and together let's feel the power of perseverance, liberation, and hope. So please, moment of silence. Thank you. Now, according to the recent data published from the Campaign for Action 2021, since 2010, there have been over 49,000 individuals who have received their DNP degrees and over 7,700 that received their PhDs. I'm going to pause here and repeat that. There are over 49,000 DNPs to date. And with that, the evidence shows there are more and more nurses of color pursuing their DNP degrees. What does that mean for us? Why does that matter? Well, it means it's a pivotal moment in nursing for us being DNP prepared nurses of color, in that it uniquely positions us to lead change and advance health equity. I was watching a video from Reckoning with Racism, and they had a series of interviews from nurses of color and their allies, and it's entitled The Collection. It can be found at www.rn-reckoning.org. I clicked on one by a participant named Kim, and during her interview, she said the following words that struck me to my core. And I'll paraphrase, but she essentially said that we often quote our claim to fame that nursing has been cited time and time again as the most trusted profession, but amongst whom? Patients of color are dying exponentially under our care, and that we would rather they die than hold our peers accountable. It's time to change the game and forge new paths. As DNP prepared nurses, we can and we are the catalyst for change, action, and justice. Our very existence in these rooms of patients of color literally saves their lives, changing the game, forging new paths. Our path to advancing health equity is recognizing that when we focus on those that have been the most marginalized, we all benefit, changing the game and forging new paths. You come as one, but stand as many. We need you to rightfully and confidently take your seats at the table in the boardrooms, as nursing faculty, as deans, leading research, publishing in the literature. Shout out to the Pathway to Publication Mentorship program that we're hosting and collaborating with Jonas. Writing policies, procedures, and beyond. We need you to set the table, set the agenda, no longer waiting for others, changing the game, forging new paths. The highest and most precious gift you can give back to others is to inspire them. Let your life be a testament of your mission and your legacy, and be sure to take others with you along the way to further their impact. And also further the standing of on the shoulders from you and the shoulders you stood on. If you don't learn anything from my speech this morning, please take this one thing with you. DNPs of color are everywhere, and we are here to change the game and forge new paths. It is an honor to be in your presence and celebrate your amazing accomplishment. Congratulations, class of 2022. Go forth and be great, DNPs of color. So regrettably, our keynote speaker introductor, Dr. James Winters, is had a last minute obligation, is currently in flight. So I will read his remarks for introducing our keynote speaker. The location, Durham, North Carolina. The year, 2012. I was an eager but exhausted nursing student searching for a reason to believe in my why. There was nothing that I wanted more at that time than to be a certified registered nurse anesthetist. Prior to this day, I had encountered a grand total of 2 African-American nurse anesthetists. Initially, I didn't subscribe to the theory of you can't be what you can't see, but I quickly found out just how wrong I was. The platform, network, and movement that this lady single-handedly curated altered my life in ways that I never could have imagined. And for that, I will be eternally grateful. Although wanting to become a CRNA was nothing new, this was the first time that I wholeheartedly believed that I was capable, deserving, and I owe all this to Dr. Wallena Gould. The true emulation of what we know as the American dream, Dr. Gould began her journey as a welfare-dependent single mother. Her tenure in nurse anesthesia began at LaSalle University in 2002, where she immediately recognized the need for an increase in minority representation in this field. She not only recognized this need, she had the courage, acumen, and resolve to effect change. As nurse anesthesia student, Dr. Gould stood in front of an audience consisting of 5 nurse anesthesia cohorts in 2002. As you can imagine, this was a time, place, and climate unwelcoming to the concept of diversity and inclusion. Yet, and still, she chose to risk it all and advocate for the many people of color that would soon follow her path. This level of passion and fervor ultimately led Dr. Gould to establish an organization entitled the Diversity in Nurse Anesthesia Mentorship Program. Throughout the last 15 years, this organization has placed approximately 658 students of color in nurse anesthesia programs, ultimately increasing minority representation of 250% within this field. There is much to be said about Dr. Gould's illustrious career, She's acted as a lead consultant for HRSA Diversity Grant awarded to the University of Tennessee at Chattanooga. She served as chair of the Diversity Task Force of our national organization, the AANA, as well. In 2015, Dr. Gould reached the pinnacle of nursing as she became the first CRNA of color to be inducted as a fellow of the American Academy of Nursing. She would go on to be an inaugural fellow. Oh, sorry, my phone. Yikes. Hand clap. She would go on to be an inaugural fellow within the American Association of Nurse Anesthesiology as well in 2018. She's the recipient of the Trailblazer Award given by the NBNA in 2019 and was given the crowning jewel of nurse anesthesia by receiving the distinguished Agatha Hodgkins Award for Outstanding Achievement. As acting CEO of Diversity CRNA, Dr. Gould continues to blaze trails and push this organization further than anyone could have imagined. She's a proud member of Delta Sigma Theta and currently serves in the capacities of faculty member, consultant, business owner, and most recently, a contributing author of what we know to be the Bible of our craft, the John Nagelhout's Nurse Anesthesia Textbook. She's a phenomenal leader, dynamic professional, and even more remarkable person. Her role in changing the face of our profession is one that simply can't be denied. It is my honor and privilege to present my mentor, role model, guardian angel, second mother, the Dr. Wallena Gould.
Thank you. Thank you so much. Again, I would like to thank the DNPs of color, the board of directors, the advisory committee, particularly to Dr. Danielle McCamey as founder of DNPs of color for this invite as the commencement speaker for this celebratory event. Thank you for the honor of spending time with you and the DNPs of color class of 2022. Most definitely, I would like to give honor and glory to our military men and women and thank you in advance for your service. Before I begin, I must say something about Captain Dr. James Winters, though. And he's serving right now currently in the United States Air Force, who I had the pleasure of mentoring for years. I can recall the very first time meeting him and to help shape his professional and educational trajectory. For James, it all started, his pathway started all the way from Memphis, Tennessee at Briarcrest Christian High School to his own DNP journey and using his gift for our community. His DNP project, his scholarly project, which I think is exemplary, was on the use of culturally sensitive education to influence attitudes to ethnic minorities in Southern Mississippi towards organ donation. And I thought that was a very compelling DNP scholarly project. I think this was something that was uniquely different that other nurse anesthesia students was not even doing. And I think this impacts, especially in the Black community. And I think this was very important. Now, this fall, just so I can continue to celebrate this young brother, Dr. Winters, Captain Dr. Winters, is his professional trajectory has huge implications in the communities of color. He'll be one of the few CRNAs of color who will be accepted into a one-year advanced pain management fellowship at Texas Christian University. And when he graduates from that program, he will be one of 3 Black men who will be eligible to sit for the non-surgical pain management fellowship credential at TCU. Now imagine investing into the community and providing service to your country, which he has and which he is still doing. But imagine you as a new graduate, you can do the same by investing in our communities, investing your service to the Black community, to the Hispanic community, to the Asian communities and indigenous communities. Now let's talk about service and mentorship through an equity lens. Let's talk about service and mentorship through a cultural lens. Let's talk about service and mentorship through a social justice lens. And what do I mean by this? I am an advocate or an activist because of all the adversity, all the barriers that came my way, honestly. Despite all of that, I stand in this space with only less than 4 CRNAs of color, all Black CRNAs, matter of fact, who are fellows of the American Academy of Nursing. One of them is on this Zoom commencement ceremony, and his name is Derek Glimpf, Dr. Derek Glimpf, who we both graduated in the same cohort of 2004, different nurse anesthesia programs, but to see our professional trajectory move in such a different way and in a different manner, but we're still in this space to make sure that we're uplifting others along the way. But I started this advocating for others way back when I was an undergraduate student myself. I was homeless, single mother on welfare, and I lived off of $273 a month of assistance, $114 worth of food stamps every single month. Like, you'll never, and I will never forget that amount. In college, I pledged Delta Sigma Theta. What saved me through my college experience was prayer, listening to songs, studying, repeat. That's exactly what I did in order to get through. And as a nurse, and especially as a nurse anesthesia student, I created this organization as a poster project. And I turned it into a national nonprofit organization right now. And I call it's a movement at this point. So for the DNP, and I'm going to say DNP and DNAP, that's the Doctorate in Nurse Anesthesia Practice, because in nurse anesthesia, you're either graduating with a DNP or a DNAP. So for the DNP or DNAP graduates, I want to talk to you about a ladder of opportunity. And what do I mean by that? There's 2 CRNA mentors who laid the foundation for me. Is Dr. Art Swirling, who told me to think outside of the box when I was a nurse anesthesia student, when I told him about my poster project. And then there was Goldie Bragman, a nurse anesthetist, who created that ladder step by step. And she was the founder of the Harlem School of Anesthesia. She was the first and only Black CRNA AANA president. She was a nurse anesthetist who came through the Jim Crow and civil rights era. She even took care of Dr. Martin Luther King Jr. on an assassination attempt back in New York City in Harlem. And she was the one that was on call and gave anesthesia. She attended a diversity CRNA event session that I had in 2008, right? So at that time, 2008, prior to that time, there were very few nurse anesthesia programs that gave us access to have a diversity CRNA event there. She actually came all the way from Hawaii to visit her daughter here in New Jersey, but she came to visit and came to our session at my church. And again, like I said, few doors were opening for us at that time, but she came and she spoke to future nurse anesthetists. And she wanted me to mentor and groom other nurse anesthetists, obviously. But after that event, she privately, and I share this this information with you and with others too. But she asked me, she said, Lena, I will mentor you, I will groom you, I will help you. I think you can become an AANA president. Now, how do you say no to a pioneer in nurse anesthesia? Well, I had to say no. I said no, but I said no with grace. Because I remember holding her hand and I was looking her in the eyes and I was telling her that I had no aspirations on becoming an AANA president, but instead I knew I had a gift. And I knew I had that gift was to help others who will stand, who will, needed the guidance to go forth and to become nurse anesthetists. Because for many of us, and I was too, first generation college graduate, and I needed that. And I told her at that time that she created that ladder. But what my job is to be at the bottom of that ladder, even though I told her that today. And even though I told her that back in 2008, to this day, I'm still at the bottom of that ladder that she created. And I hold it firmly so that Captain Dr. James Winters can use his gift to step up that ladder to go into pain management and be an expert, so that Dr. Soror Regina Daniels McKinney can continue to use her gift to rise up at that ladder with her own nonprofit nursing cap in Virginia and assisting youth in exposing healthcare professions to our very young, to the very young people that live there in Virginia. You see, as new DNP and DNAP graduates, I see you. I see you as future faculty. I see you as future leaders in the healthcare system. I see you as leaders in the government speaking on health equity. I see you as future fellows of the American Academy of Nursing. And the reason why I'm just going to pause and just say that, because I didn't hear that in nursing school. I did not hear that in nurse anesthesia program. So, and I'm telling you, you are the future contributors to nursing, and I can see you as future fans as well. And also too, as DNP and DNAP graduates, I could see you writing and contributing chapter authors of your respective APN books. I can see you being published in, you're publishing your manuscripts for journals. And now you have an opportunity to have a mentorship program. I mean, I wish I had that when I was coming right out of school. And I think you should most definitely take advantage of that. So yes, the community needs all of us. And whether you live in another community from where you started at in nursing school, the thing is that I'm going to ask you to do is always return back to that community and pay it forward with mentoring, with advocacy, but most of all, show up. And I don't mean by monetizing your gift, because that's what you have. You are a DNP, you have something to offer, you have a gift to help others, but do so with a generous heart. Why is this important? Because the community sees you. And just like Marian Wright Edelman said, and I quote, "You can't be what you can't see. Trust me, I see you." And others are following you in your own footsteps and watching you too. But I do want to last thing I want to just say is that if you go on to YouTube, if you have a streaming device where you can listen to music, there's a song that I want to just dedicate to you. No, I'm not going to sing it. I want you to look at this after the ceremony is over. It's by CC Winans, and it's called Alabaster Box. And that song resonates with me in my own journey. So as a DNP or DNAP graduate, treat your gift like oil, as referenced in that song of Alabaster Box. You should understand the cost of that oil. You don't know, in that song, it says, you don't know the cost of my praise. You don't know the cost of my oil in the alabaster box. So when I was homeless in one of the darkest moments of my life with a 14-month-old, I remember his presence. I remember I felt his loving arms around me. And that's why I love him so much. So I know that cost of the oil. And I know that you all will do great things with your gift. And at this time, I'd like to thank you and congratulations to the class of 2022. Thank you for inviting me to speak at your ceremony. Thank you.
Thank you so much, Dr. Gould, for that inspirational message. Always love your support and connecting with you and the impact that you made to pave the path for a lot of us, including me and also DNPs of color as an organization. Now I would like to present Dr. Cecilia Boyd, who will be presenting our graduates.
Thank you. Dr. Irene Amoko Atta, Texas Women's University. Increasing patient participation with colorectal cancer screening and primary care, an evidence-based improvement initiative. Dr. Alfonso Baker Sr., West Coast University. Team steps in nursing leadership, building cohesive teams. Dr. Tiffany Bell, University of Florida, increasing education of immediate appointment scheduling to decrease care lapses in outpatient mental health care. Dr. Christian Paul Billion, Texas Christian University, telehealth, a guideline and toolkit for implementation in a pandemic. Dr. Lydia Bonner, Troy University, stepping up fall prevention. Dr. Naisha Bonnet, Chamberlain University, ending the opioid crisis. Dr. Jasmine Bosley, Touro University, assessment and non-pharmacological treatment of sleep in adults in a private practice mental health clinic. Dr. Elaine Brown, Stony Brook University, the impact of bundled appointments on compliance in gestational diabetes mellitus postpartum screening. Dr. Shanine Burnett, the George Washington University, a telehealth blood pressure education program on hypertension knowledge, self-care, and behavior. Dr. Leah Bouchot, Chamberlain University, improving self-efficacy in type 2 diabetes. Dr. Katea Charitable, Chamberlain University, implementation of mindfulness-based interventions to prevent nurse burnout. Dr. Laquana Davis, Loyola University, New Orleans, the implementation of preventive measures to decrease the incidence of hospital-acquired pressure ulcers. Dr. Chibuzo Efuribi, the George Washington University, effect of a web-based educational intervention in improving depression knowledge and help-seeking behavior in women. Dr. Takara Figueroa, Chamberlain University, obesity in the elderly. Dr. Terrell Foster, Rosalind Franklin University of Medicine and Science, exploring the role of HBCUs in nurse anesthesia education. Temitope Baroa, Grand Canyon University, idiopathic pulmonary fibrosis improving supportive care pathway. Sheena Gonzalez, University of South Alabama, implementation of the safe environment for every kid, the SEEK model, in the early detection of psychosocial risk factors for child maltreatment in pediatric primary care. Dr. Sheila Mimi Garacha, Rush University, using Asthma ID to identify students with asthma in Chicago Public Schools. Dr. Shannon Henry, Old Dominion University, supporting diverse and socioeconomically underserved patient populations in a Black-owned pediatric primary care clinic. Dr. Dorothy Higgins, Grand Canyon University, evaluation of pressure injury prevention care bundle on hospital-acquired pressure injuries. Dr. Nichelle Hines, Wilmington University, reducing delay times for patients being admitted to an inpatient unit after the decision to admit by standardizing the handoff process used during interdepartmental handoff communication. Dr. Keisha Holmes, the George Washington University, ventilator-associated pneumonia bundle compliance, a quality improvement project. Dr. Citrell Janelle, Chamberlain University, preventing patient falls in the acute care setting using AHRQ's fall tailoring interventions for patient safety tips toolkit. Dr. Tarina Jerome Harris, University of San Francisco, creating a pipeline to increase diversity in nurse executive leadership. Dr. Isabel Joseph, University of Pennsylvania, increasing the utilization of phenobarbital in moderate alcohol withdrawal in the ED department. Dr. Mariama Kieta, University of Maryland, implementation of telemedicine during ICU rounds to increase family presence. Dr. Shanice Kukuk, University of Wisconsin, Oshkosh, improving sleep hygiene to decrease delirium among critically ill patients in the transplant ICU. Dr. Deborah Latorre, Johns Hopkins School of Nursing, hypertension guidelines adherence among providers in the retail health setting. Dr. Doris Lucien, Grand Canyon University, enhancing cardiac rehabilitation enrollment using life after heart attack pre-discharge intervention. Dr. Kimberly Madison, the George Washington University, antibiotic stewardship for asymptomatic bacteria in older adults residing in long-term care at end of life. Dr. Octavia Manuel Wright, Aspen University, improving depression screening in primary care. Dr. Stephanie McBurrow, Augustus University, clinical staff education and program plan to measure and evaluate the effectiveness of intravenous loop diuretics for patients with acute heart failure. Dr. Kelsia McSeer Sanders, University of South Alabama, improving primary care-based childhood obesity management in high-risk minority populations. Dr. Angel McCullough, Walden University, preparing patients living with SCD to better manage their disease at home. Dr. Jalenza McGee, University of Alabama, implementation of a patient navigator program to reduce 30-day heart failure readmission rates. Dr. Tiffany McGowan, University of Texas, the development and implementation of a DNP student-led peer mentoring program. Dr. Regina McKinney, Chatham University, increasing airway management knowledge in post-anesthesia care unit nurses utilizing e-learning and simulation. Dr. Trahina Montgomery, Georgetown University, impact of an online education intervention on healthcare providers' self-efficacy for assessment and care of clients experiencing female sexual dysfunction. Dr. Stacey N. Wakuba, University of Maryland, implementation and evaluation of a patient handoff tool to improve nurse-to-nurse communication. Dr. Consulate Oboro Bindum, Pennsylvania College of Health Sciences. 1 week follow-up of MI patients, a quality improvement project to increase the use of an NP-led discharge clinic and assess outcomes. Dr. Stephen Okoth, Old Dominion University. Burnout and intent to leave amongst CRNAs redeployment during the COVID pandemic. Dr. Fumilaria Oni, I'm sorry. The George Washington University, implementing skin bundle in a long-term care facility in Maryland. Dr. Timothy Anserio, University of Massachusetts Amherst, leveraging social determinants of health screening to improve health disparities in Southern Maryland. Dr. Chisa Parker, Grand Canyon University, Fit for God's Holy Use, health promotion among a fellowship of churches. Dr. Pamela Pickens Taylor, Troy University, implementation of student nurse mentoring in entry-level baccalaureate nursing program. Dr. Natasha Roberts John Finn, Texas Women's University, the impact of a nurse practitioner-led targeted intervention guideline to prevent 30-day readmissions among high-risk heart failure patients, a healthcare outcomes project. Dr. Kim Rutley Campbell, West Coast University, assessing medication administration interruptions and distractions in a post-acute setting, an observational study. Dr. Annette Sampson, Oregon Health and Science University, identifying cervical cancer screening challenges at a tribal health center, a qualitative patient perspective. Dr. Sharissa Samuels, Chamberlain University, the enhanced recovery after surgery protocol with preoperative joint replacement education, the impact on patient anxiety. Dr. Natalie Sharp, East Carolina University, developing a staff development program for nursing assistants in long-term care. Dr. Deanna Stewart, University of North Carolina at Chapel Hill, implementing a safe space for African-American employees to develop individualized racism recovery plans. Dr. Dawn Siraj, Pace University, an educational intervention to improve clinicians' knowledge and confidence in pain management. Dr. Sharon Ann Taylor Smalls, Stony Brook University, the impact of midwifery continuity of care on adherence to care in a U.S. urban setting. Dr. Gertrude Thomas, University of Minnesota, improving patient safety through structured multidisciplinary rounds. Dr. Ugachu Ukwa Bulam, Texas Women's University, improving cervical cancer screening rates and utilization of evidence-based treatment guidelines at a rural primary care clinic, a quality improvement project. Dr. Suzette Van Buren Hayes, University of Alabama at Huntsville, implementing and evaluating a dementia screening tool in primary care. Dr. Maria Vasquez, Capella University, implementation of a communication improvement tool in a county Department of Health. Dr. Ashley Whitlatch, Southern Illinois University, establishing care with a primary care provider. Dr. Taruko Williams, University of St. Augustine, perception is everything. Implementation of a peer evaluation program for nurse leaders in a hospital setting. Dr. Letitia Wilson, Texas Women's University, evaluation of an evidence-based algorithm for patients with acute respiratory failure, a quality improvement project.
Wow, let's give a hand clap to Dr. Boyd. That was not a small feat to present graduates. So virtual hand claps, unmute yourself if you want to do a real clap.
Thank you.
Thank you so much, Dr. Boyd, for taking on that wonderful challenge. And next, I'd like to introduce Dr. Ethlyn McQueen-Gibson, who is our Vice President of our Board of Directors, for our closing remarks.
I want to say it is still morning, but we are quickly approaching the noon hour. So first of all, my remarks will be very brief. We first of all would like to again congratulate all of our graduates. And we would like to say that all of their doctoral research, just think about all of the changes that they will be making across not only our country, but across the world. And those that are coming behind them, think about what our great speaker, Dr. Wallena Gould, told us, the changes that they will be making. On behalf of the Board of Directors and also our advisors, we'd like to thank all of the family members who are on the screen, all of the support that have been with you, whether they are children, grandparents, aunties, uncles, neighbors who have all been there supporting you. We know that there is always a village behind you. I think our next slide will also give thank yous to our sponsors who have also made all of this possible for us. We have Melanin RX, we have Dr. Marshall Blue, and then also our diversity and nurse anesthesia mentorship program. We couldn't do that without any of our sponsors that have been here with us. So I think the very next thing that we get to do is a very fun thing, which I think is the photo. Is that not correct, Dr. McCamey?
Yeah, so we just want to just pause and just celebrate the weekend that it is Juneteenth. Dr.
That is correct.
Go back just one more slide.
One more slide.
He's quick with it. But just again, just honoring that it is Juneteenth.
Go back one. Yes, there we go.
So a day of recognition, restoration, and celebration, and just really understanding that today and every day we honor the sacrifices of our ancestors, walk in their strength, and remain committed to the work ahead. So next we can unshare the screen and get ready for our group photo. So there is a lot of people in the house. We love it. So if you can turn on your cameras. And who is able to take the picture? Because there is a couple of screens.
I actually have my camera.
Perfect. So let us know when you're ready.
Okay, so here we go. 1, 2, 3. Okay, let me get the next screen. Now on this screen here, I see a lot of names, but I don't see cameras on. So can we put cameras on? If everybody can turn cameras on. I'm gonna let everybody turn cameras on. I'm waiting on cameras. They're coming on. Okay, I'm ready for screen number 2. 1, 2, 3. Okay, and now I'm going to, oh, let's see. Okay, we're good.
Awesome. So feel free to unmute, clap, send your shout outs. And if Dr. Ethlyn could put up the slideshow, there's just a couple of just reminders as we close out.
Here's James.
And it looks like Dr. Winters made it. So we want to give him a shout out. Yes, Dr. Winters, did you want to say a couple of words before we close out?
Sure. Can you hear me okay?
Yeah.
Okay. So first off, I'd like to apologize. I was my travel itinerary.
He was supposed to be there, but
switched.
he was, I think he's in the airport or something.
Yeah, I'm definitely in the airport. So my flight got changed, like many of them have been lately. But that's neither here nor there. I just want to congratulate you all on accomplishing this, reaching the pinnacle of our profession as nurses. And hopefully this event, as well as this organization, will show you that you do have resources available. Please feel free to reach out whenever you feel necessary, you need help, guidance or whatever. So everybody here is more than willing to help you in any way that they can. But congrats, proud of you and happy for you.
Thank you so much, Dr. Winters. It's good to see you, and thank you for persevering and joining us. We really appreciate that.
Problem at all. Thank you for having me.
Yes. So just reminder, save the date. We will be hosting our second annual conference. It will be hybrid, and the theme is DNPs of Color, Changing the Game and Forging New Paths. It will be October 21st through 23rd in Baltimore, Maryland. Details on specific location and hotel and registration will be out at the end of this month. And next slide, there's a save the date for those December graduates, December 18th, 2022, 11 a.m. Eastern. We usually have a spring and winter celebration around Juneteenth. So the 18th, 19th of the month, that's Saturday. So just so please tell your friends and invite them to come join us in December. And I think we have one more slide. Please be sure to follow us on Twitter, Facebook, Instagram. We'd love the support. And if there are any other board members that would like to share a couple of closing remarks, and if not, we will close out. All right. Thank you so much for sharing this wonderful event with us. And we wish you well.
Something I just want to recognize Dr. McCamey, but she puts in a lot of work behind the scenes. She doesn't like to be put on the spot, but I'll put her on the spot anyway. So I would personally like to recognize Dr. McCamey. She does a lot, and we talk a lot, and then she has a true passion to see this thing go forward. So like I said, she's humble. She doesn't like to brag up, but she definitely deserves the recognition. But there's a lot of work and trying to get things together, trying to scramble everybody and make things smooth. So like I said, kudos to her.
Yes, our founder of DNPs of Color. Let's all give a big round of applause to our founder, Dr. McCamey.
Woohoo! Yes.
Thank you so much for this opportunity.
Yes. We love you, Dr. McCamey.
We love you.
Awesome.
Thank you so much, everyone, for the love. I really appreciate that. It means more than you will ever know. Thank you so much. All right, if there's nothing else, thank you so much again. We'll have the recording up in the next couple of days, but feel free to reach out to us. We're always available, and thank you again, and congratulations, class of 2022. Goodbye.
Thank you so much.
Thank you.